Craniosacral therapy was developed by John Ledger, who is an osteopathic physician. So it stems from osteopathy. It works with the belief that the body knows how to heal itself. It's a light hands-on modality. I put my hands on to feel the rhythm throughout the body, and this rhythm is created from the cerebrospinal fluid that encases the brain and the spinal cord. And that volume of fluid increases and decreases slightly in pressure, creating a rhythm throughout the body. So we can feel that rhythm throughout the body and tell where there's a restriction. And also there's a way in which you can see where energy is being held and walled off in the body. And also check in with the fascia. The fascia is a thin film that wraps around all the muscles, all the organs in the body, like the opaque film that you see on a breast of chicken. And so I feel into that, and so that gives me a few different places to evaluate the body and see where we should start. So when I first meet somebody, I take a history of what's going on for them, get a sense of their overall sense of well-being, what are their chief complaints, what is going on for them, do they have back pain, neck pain, headaches, how people are sleeping, how they take care of themselves, any medication they're on. Just get an overall picture of them from that perspective and find out what results they want from their craniosacral therapy, why they've come in to see me. So after I get a sense from them, then they come and lie down on the table. They're lying on their back, fully clothed, and I then place my hands at the feet, start to feel the craniosacral rhythm throughout the whole body, through the legs, through the torso, arms, and then through the head. So then from that check-in, I then know where to start in the body, which is more at the source of the issue as opposed to necessarily where the symptoms are being felt for somebody, which can be a little bit confusing if somebody's coming in with knee pain and I start to work at the pelvis. But that's because the body's showing up that a lot of the holding and restriction is at the pelvis, and once that opens up, then the knee pain will start to feel better. So I'll place my hands in that area, above and below the area that's showing up in the body. And then I listen with my hands and follow the tissue. So my hands will be guided by the body, and my job is to support and listen with my hands. So I follow the tissue and wait for signs of release, and they can be a feeling of heat and warmth, maybe some pulsing. Maybe the client will take a deep breath, or they may report feeling a strange sensation, maybe like a tingling down through their legs or their arms. All those are signs of a letting go, of the tissue letting go and releasing.
It's very relaxing. As soon as you walk through the doors, you just feel a sense of peace. And once Kate gets you on the table, it's amazing because the first time I had no idea what to expect, and as soon as she put her hands on me, it's like you feel a sort of energy. It's like heat, and it's like your body almost like directs her to where your pain is.
So as I'm working, what I ask the person on the table to do is to notice sensation in their body and to track the sensation they're feeling. So and I ask them to let me know what it is they're noticing. So sometimes there may be a feeling of pain or discomfort. Other times there's a feeling of heat and of letting go or of tingling. Oftentimes those are kind of strange sensations the first time they've experienced them, and sometimes it's hard to find the words for them. Oftentimes they're described as weird. It just feels kind of strange. Sometimes a memory will pop back into them, something that they've remembered from a long time ago, maybe a fall in their childhood or a car accident they had like 10 years ago. That's not something they remember, but that spontaneously comes into their head. And so we'll often just go back and check in to see if there's anything else that we need to acknowledge about that experience. And then other times people will experience a very, very deep sense of relaxation, and they will describe it to me as they're not asleep and they're not awake, but they were just very, very deeply relaxed. And in those kind of sessions, there's very little conversation, there's very little talking that happens. So each session is very unique and individual, and so I will work in a way that suits that person. So sometimes there's a need to talk, other times there's a need for silence. So I'm Kate McKinnon, and I came to craniosacral therapy hearing about it as a physical therapist. In London, I was working with children with disabilities, and many of those children were receiving craniosacral therapy, and that was my first time of hearing about it, and I have to say I was very skeptical. And then a good friend of mine received some work in London, and it really, really helped her with her health. She was having some issues with her teeth, and it made a big difference. And then shortly after that, I moved to America, to California, and started to research a little more about it and received some work on myself and found it to be very beneficial. So then I took my first class in Esalen in Big Sur, and was pretty much hooked from that point on. I continued to work as a pediatric physical therapist here in California, and at the same time set up my own practice of doing craniosacral therapy, but use the craniosacral therapy work with the children I was also working with. And then just slowly built up my private practice to the point where this is what I do full time, and love it.